I think that we can all agree when I say that parenting is no easy feat. While it is rewarding, it can be emotional, stressful, and sometimes even confusing. On this episode of Ask the Doc, no appointment needed, I'm going to answer all of your questions regarding child rearing, screen time, nutrition, and more on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics here in Kendall, Florida. On this episode of Ask the Doc, I'm going to address all of your parental concerns regarding child rearing, safety, and the overall well-being of your child. You know, pediatrics isn't just about giving vaccines and signing school entry forms. As a pediatrician, we are here to support you on your parental journey. We're here to guide you and give you the best advice we can so that you can make informed decisions on the health, well-being, and safety of your child. So we have some questions coming in now. Let's get started. Frank, my sister lets her 2-year-old spend hours on the iPad, whether it's watching shows or playing games. I tried to tell her this hurts her brain development, but she downplays it because it keeps her daughter busy. What can I tell her that will hopefully get through to her? You know, that's a great question, Frank, and we oftentimes see this. I'm sure all of us have been out to dinner and seen families at the restaurant with their toddlers sitting at the table with an iPad or a cell phone. And it is really hard because I understand on one hand, you know, you want your child to be quiet and kind of stay out of the way and be entertained by an iPad or by a device. But on the other hand, this is really affecting their social interaction and development, which I think is really hard to balance. I think the best thing for you, Frank, to tell your sister is that you want your children, you know, she wants her children not only to develop appropriately, but to develop social interaction. I think everybody really focuses on the academic part of it, and they're worried about maybe like academic delay, but what's really important is social delay. If your child doesn't know how to interact with others or entertain themselves in a social setting without being hypnotized by a device or by a movie, then that's a problem. And maybe that's something that you should drive home with your sister. Is that, hey, you want a child who's not only learning, not only smart, but also can truly interact with human beings, because isn't that the one of the most important aspects of our life? We are gregarious creatures. You know, here are a couple bullet points I will say from the American Academy of Pediatrics and what some of our recommendations are with overall screen time. So from 18 months of age and younger, honestly, we advise against any type of screen time, except of course, you know, nowadays we video chat with family members and friends, and that's just become the new norm. But as far as entertainment with a show or a movie, we do advise against it under the age of 18 months. From 18 to 24 months, maybe like a high quality educational media program that also has parental engagement. You know, again, you still have that social aspect where you and your child are watching together and interacting, learning, answering questions. You know, that's kind of the modern way to learn today anyway. Once your child goes into school, they will have a lot of artificial intelligence and programming to help them complete lessons and learn. So this is a good time to introduce it. And after 24 months of age, let's say about 2 to 5 years old, you know, obviously they're going to start to not only use the interactive learning devices, but they're also going to watch shows and movies and entertainment, of course. But we recommend usually no more than an hour a day. Now, these guidelines are, of course, are very loose just because things have changed so dramatically. For example, ages 5 and older, we used to say no more than 2 hours a day. But again, like I said, once your kids are in school, they're going to use these devices for school activities, whether it's to complete homework or to learn a lesson or to watch a video that they're going to have to report back on the next day in class. So while we say 2 hours per day, you have to take that with a grain of salt, because we understand that there are times that you're going to have to use it for school. But for entertainment purposes solely, or quote unquote babysitting your child, I would certainly recommend no more than 2 hours. Preteens and teenagers are tough, of course, because they kind of have their own schedule, they have autonomy, and you really can't monitor their screen time, but you want to encourage them to balance their screen time with physical activity and healthy habits. What I will also say, Frank, it's very important to note that the problem with screen time is not only social development, it is not only academic development, but also it has a very, very negative effect on the eyesight. Kids these days are far more myopic than they were many years ago because of the increased screen time. Optometrists recommend that your child is actually getting outside sunlight at least 3 hours a day. So whether they're inside on a device or even reading a book, it is recommended to put that down and to go outside. It is very important for our eyesight, or for the development of your children's eyes, or an ocular health, excuse me, to get sunlight. So these are the main reasons why it's very important to really try to limit screen time and limit indoor entertainment. I hope that's enough for you to go back and talk to your sister about, Frank. It looks like we have another question coming in. Fiona. Fiona wants to know, we had a pool put in a few years ago, and we now have a 3-month-old baby. We keep our pool fence up all the time. When should we begin teaching the baby how to swim, and more importantly, how to get to the stairs or side of the pool? We love our pool, but I'm scared to death because I know it only takes a minute for something bad to happen. Fiona, I totally understand your fear. I also had that experience when I had my children. And to be honest with you, the pool fence is definitely the best measure that you can have in the home. I would keep that pool fence up until your children are, independent and can be trusted outside with a pool in the area. So that's usually 5 or 6 years of age, to be honest. As far as teaching your child how to swim, swimming under the age of 3 really is a skill that can be learned, but not maintained. When they're young, they'll forget easily, and sometimes we don't want families to have a false sense of security that the child can swim, so they kind of let their guard down a little bit and maybe don't watch them as closely around the pool. You can start the swim lessons for sure. Usually they start them at 6 months of age. And then they teach them how to find the stairs, how to get to the side of the wall. Those are all great survival skills. I don't advise against them. I think they're great. I just don't want you to think that that is a safety measure. It is not a safety measure. The fence is a safety measure, and being outside with your kids at all times, and actually having an adult assigned to watching the kids. And what I mean by this is that a lot of families feel that once everybody's outside, whether it's a barbecue, a get together, or you're just sitting outside talking, every adult assumes the adult next to them is actually watching the kids or has an eye on the kid. And usually that means that nobody is watching the kids. So you have to acknowledge that you are actually watching the child or children, and speak to the people around you and just confirm that one of you always has an eye on the children that are in the pool. A lot of times these accidents happen while the adults are out there quote unquote supervising the children, because the feeling is that once you're there, once you're present, you're supervising, and that's not necessarily true. Of course, I also advise not drinking while watching the children, or cooking and entertaining while watching the children. Like I said, just because you're out there doesn't mean you're actually watching. So please keep those things in mind. Please practice pool safety and absolutely keep that fence up. Okay, it looks like we're getting a question from the Facebook page. This is from Veronica. My son lost faith in vaccines after COVID and now says he's hesitant to get his daughter vaccinated for any diseases. Please help me with some stats and information I can share that will make him change his mind. Well, Veronica, as far as stats are concerned, I mean, he's living in it. He's living in a world where, in a country where diseases were actually completely eradicated. He lives in a society where you don't have children dying from diphtheria or Haemophilus influenza, meningitis. They're not dying from polio or becoming paralyzed from polio. I mean, he lives it every day. So those are the stats that he needs. It's just proof, people don't understand that this luxury that we've had, where we live in a society where we don't have these harmful diseases killing young children, This is because they were vaccinated. The vaccines protected us as a community. So it's important that he understands that. And, I really don't understand when people say because of COVID, they don't want to vaccinate. I mean, because of COVID, you should want to vaccinate. We saw it with our own eyes. We saw people dying from COVID left and right. And then when a vaccine was rolled out, it was almost immediate. People were getting COVID and it was kind of like a cold or a flu. They got over it quickly and they were no longer needing a ventilator or having to go to the hospital. So it was right there. We got the vaccine. That's what we wanted. And now getting COVID is like getting the flu today. That's not because of time or elapsed time. That's because of herd immunity. So, I mean, I think the idea is just kind of reiterate those facts to him that he's observed himself. You don't even need to go look it up. To just look at what's happened over the course of time and look at history. It is important to vaccinate and protect our children against diseases that can cause death. This is so important for your own children and as a society to protect each other. Well, good luck, Veronica. I know this is not easy. If you guys want to send in your questions, here's how to do it.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Okay, well, it looks like a lot of people have questions. Here's one coming in from the All Health TV app. Kevin, we think my son has food allergies and are starting to do tests. Until we figure out what it is, I'm worried he will eat something and have a bad reaction. When he is with his friends or his grandparents, do we tell them not to feed him certain foods or do we wait until we know for sure? Well, Kevin, that's an interesting question. First of all, I would need to know what happened when he had, or what makes you think he has an allergy to foods, rather. So if he has eaten something in particular that has caused hives, eye swelling, lip swelling, tongue swelling or burning, or maybe a GI reaction like vomiting and diarrhea immediately, whatever caused that reaction should be eliminated from his diet until confirmation. The best allergy testing, honestly, is what we call an oral challenge, and that's actually ingesting the suspected allergen to see if there's a reaction. So if you already know that there's been a reaction and you've seen one, please eliminate those foods from his diet. And of course, confirmation is important. Following the allergist is important so that you can move forward and find out if there are other allergens that are present, and also if there is therapy that is available. But for the time being, if you saw a reaction, then you have your answer. Okay, so we have another question coming in, and this is coming in from the Facebook page. It's from Monica. My baby is getting ready to start walking, and that means it's time to make sure our house is child-proofed for safety. Can you share a checklist of things I need to make sure are taken care of to keep her safe? Sure, Monica, that's a great question, and it's so fun once they start walking. While it's super cute and maybe a little bit stressful in the house, it is really fun to watch them explore and learn and walk around. So here are a list of things that I would do in the home to keep your child safe. Your toddler, excuse me. So first of all, you want to definitely protect all of the outlet covers, all of the outlets, with outlet covers. You can get those on Amazon or at any pharmacy, and any outlet that you find, especially outlets that are at the toddler's eye level, you want to cover them. You want to install a cabinet and door locks. Those are great, especially for lower cabinets. Of course, we have some household products in the cabinets that we want to protect the kids against, but also just like dishware and pots and pans and things that can really harm them. So any cabinet, high or low, I would absolutely put the cabinet lock on them. Also, you want to avoid cords on blinds and drapes. So those are just like trip hazards, especially since they crawl around in different spaces and try to squeeze in tiny little spaces in the house. So certainly try to avoid those cords. And then finally, some people choose to anchor their furniture down. I mean, that just depends on, how dangerous it might be. Sometimes it's a little difficult. But that is one of the recommendations. Also, you want to be aware of chests. Those are the infamous chests that babies will lean on and push and play. And sometimes they just topple over, which could be a very dangerous situation. And finally, most importantly, Lock your doors. You have no idea, these children love to open doors, and everybody thinks that the doorknob is maybe out of reach. It's never out of reach. Toddlers love to open doors. They get out, they end up on your driveway, the backyard, your patio area that has a pool. I mean, these things happen. Sliding glass doors, any door, you have to keep it locked at all times. Make sure you're storing your medications. Please, this is so important. Medication should always be stored in a cabinet that's completely out of reach to all children. And if for some reason it has to be in a cabinet that's eye level, of course you have the lock. But medications, all medications, whether it's child medications, baby medications, or your own, should always be stored safely in a cabinet way above reach. Again, like I mentioned before, you want to secure the exits and entrances to your house. And of course, never let your guard down. Never think that something is out of reach or impossible for your child to get. That's the first way you have your guard down. Just always think to yourself, anything is possible. You have to always be on guard. Good luck with your walking little toddler. Okay, looks like we have a question coming in on the All Health TV app. This next question is from, Carl. With 2 children in the house, including one that's 6 months old, I'm always paranoid about choking hazards. I'm especially concerned about them actually choking on food. Are there any tips you can give me to prevent choking? And what besides calling 911 can I do in case they are choking, especially the baby? Well, I hope you never have a choking baby in the house. That is terrifying. Well, let's talk about the choking hazards. If you have other kids in the house, you definitely want to that are older, you want to make sure that they do not leave their toys lying around. Their toys are choking hazards. Legos, action figures, little pieces to Barbie sets, Barbie clothing. Those are huge choking hazards. And it's up to you to really make sure that their toys are put away and they're not just lying around on the floor, especially for a 6-month-old. I'll go over some of the other choking hazards in the house that are very important to remember and look at. But first, let's watch this video on what to do if, in fact, your child is choking at home.
Welcome to Saving Lives with Gus and your host, Dr. Raj Ruparel.
Hi there. We're here in Mayo Simulation Center's mock operating room again. You may remember Gus from our Heimlich maneuver video. At the end of that video, we said don't perform that maneuver in infants less than 1 year of age. Well, Gus Jr. is waiting for us in the control room. He's going to help us demonstrate. Let's go. This is the control room, where we can run, lead, and record simulation-based scenarios for education purposes. But today, we're just going to be working with Gus, who's going to help us out with infant Heimlich. To perform this maneuver on an infant, here's what we do. Support the head and body with our hand and forearm, careful not to cover the mouth. Flip him over, supporting with our leg. We're going to deliver 5 back blows with the base of our palm. We flip the child over, again supporting the head and body with our hand and forearm. And we will now deliver 5 chest thrusts with 2 fingers between the nipples. And we will repeat this process until help arrives or the object is expelled. That's how to perform this maneuver on an infant. Do you remember how we perform the Heimlich on an adult? Thanks for watching. Pass this on to a friend.
Well, I hope that was very helpful, and I hope that you don't have to use it. So let's talk about choking hazards at home. We discussed a lot of the toys, toddler toys that might be lying around. It's also important to remember, as far as food is concerned, that when your child is starting solids, which is usually around 8 or 9 months of age, you want to cut them into very small pieces so that if they don't chew it and they just swallow it, they'll be just fine. So you want to cut them into very small pieces, and you want to make sure the foods you're giving are relatively soft. For example, grapes need to be cut into quarters. Grapes have skin around them, and they can cause a very big choking hazard as they're held together and compacted, and will lodge the esophagus. So grapes have to be cut into quarters. Sausage is not recommended, or hot dogs. Again, they're in an encasing or a skin, so that will hold it together and lodge in the throat. If you do give sausage or hot dogs or anything that's in the skin, you want to cut it into quarters or even eighths, so as small as possible. Any fruit that you want to give them, you cut into small pieces and make sure the fruit is ripe so that it's soft enough for them to chew. And if they don't chew it, they still just swallow it whole and they're fine. So these are all the types of foods. We don't recommend peanuts. Why? You can't cut them into quarters or halves. And peanut is a very, very big choking hazard. It's the most common cause of aspiration. So we don't recommend peanuts, not because of the allergy, but the actual peanut is a choking hazard. So remember, soft foods that can be cut into quarters or even eighths, foods that are not wrapped in a skin or a casing. You want to keep the toys out of the way, put away so that your child doesn't have access to it to grab it and put it in their mouth. And of course, always remember how to perform the Heimlich. And please remember, never stick your finger in your child's mouth. The first instinct for every parent is to go in there and try to grab whatever it is that their child ingested. Please don't do that. You will risk pushing that object deep into their throat or lodging it. So always flip them over right away, like Gus mentioned in the video, and start Heimlich, but never do the mouth sweep or put your finger in their mouth. Okay. If you want to, if you're not able to get any of your questions answered, you could always use Ask Hanna, and here's how.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.
All right, it looks like we still have a couple more questions coming in. Let's see what we can get to. Debbie, it is really scary to know how many different poisons and toxins are around the house. How do I know what is poisonous and what won't harm people? And if the kids do eat or drink something poisonous, is inducing vomiting always recommended? Please help. Debbie, what I will say is that one of the good things about poisonous toxins and things like that is today, many of the products that we use at home are no longer terribly poisonous. There are so many natural products on the market for this reason, to help us clean up the house that are not going to pose a threat to our child. Of course, Clorox bleach is still an oldie that is always going to be around, and ammonia and things like that. But there are a lot of options for cleaning products, surface cleaning, floors and things like that that are not harmful. So that's something to look into. Like I mentioned earlier, you've got to get the cabinet locks. Any cabinet that contains cleaning products or quote unquote toxic products should have a lock on it. Finally, I always recommend having the poison control magnet on your refrigerator. It is so easy. It's been the same number for over 30 years. Anybody that's at your house and sees that the child might have ingested something can immediately call poison control. There is someone on that's available 24/7 that will answer the call and guide you through the process and tell you exactly what to do. And if the child has ingested some type of toxin, you tell them exactly what was ingested and they're able to guide you specific to that ingestion. So poison control is a very important number to have in the house. And that is really just for all time. I think we still have our poison control magnet on our refrigerator. As far as inducing vomiting, no, the recommendation is no longer to do that because that is an aspiration risk. So you don't want to induce vomiting. Honestly, the recommendation is if you suspect or have witnessed your child ingest something, you immediately call poison control and they'll tell you what the next steps are. Okay, so let's see. It looks like on Owl Health TV, we have one more question coming in. This is from Philip. My 8-year-old daughter ran a fever of 101, and since I didn't want to run to the doctor every time she got a cold, I treated it with over-the-counter medications at home. Here's the question. What signs should I look for to know if it's something more serious that needs prescription medications? Well, Philip, I'll answer you with this. You don't need to necessarily check to see if it's something serious that requires medication. What you need to do is watch the signs and symptoms of your child. If your child is not improving in 3 days or so, is worsening or developing any type of respiratory distress, unable to drink, unable to eat, you need to bring your child to the doctor. Whether or not they need medication is up to the doctor to decide. But if you have a child that's sick and not getting better, is actually getting worse, or showing signs or symptoms of distress, respiratory, gastric, dehydration, any type of distress that you can't control at home, then you need to bring your child to the physician. And that's the best rule of thumb that I can give you. I hope that these questions have helped you, parents at home, kind of make some informative decisions and guidance in your home. Thank you so much for joining me. Again, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics here in Kendall, Florida. Thank you for joining.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Looking for a fast, free, and convenient way to get expert health advice? Ask Hanna. Ask Hanna is your go-to telemedicine service provided by the Health Channel. Whether you have questions about your health, need advice on wellness, or want to know more about medical conditions, Ask Hanna has you covered. From the comfort of your home, you can chat live with a health advisor, check your symptoms, and learn possible causes, and browse through a library of health articles. So why wait? Visit askhanna.tv today and take control of your health with Ask Hanna. Your health, your way, anytime, anywhere. Ask Hanna, your trusted health companion.